Absolutely. And, I'm really grateful for the input that the BCTF has had in all of the planning that we've done. And I know that they are committed to doing the best that we can to ensure that our children have what they need and that educators have what they need in the school system coming up. But yes, this plan, the details will be worked out on an individual basis, but the framework and the bones of it are what we need to have in place to make sure that it's safe for children and it's safe for educators and it's safe for staff. And, that's the whole aim here. We have a long history in public health of working with our schools and working through all of the different things that we can be faced with, whether it's measles outbreaks or meningitis outbreaks, whether it's the pandemic of influenza we had, or now COVID. And these are the important things that we have in place to keep everybody safe. And we know we can do that. We've looked at all of the other essential workers that we've had working over the past number of months, whether it's healthcare workers, whether it's our police services, our fire services. We have found ways to work safely, and I expect that will happen in the schools as well. And we've had a good practice run in June where we've learned a lot about what things can work and what things aren't going to work, and that's been what has helped us to develop this framework, as well as learning from other school settings from around the world. So when we're talking about the learning groups that we're creating in schools, it doesn't mean that it's the same as your household bubble where you hug your mom and your kids and your sisters and brothers. It's about maintaining physical distance as much as you can, but recognizing that it's not always possible in those situations, and that you want to have your potential exposure group to be much smaller than an entire school. So for most schools, and we know the size of schools, it'll be 1 or 2 classrooms that'll be together. So it won't be 60, but the maximum is 60. And for older children, we know that they're better able to maintain their distances, and we need to have a bit more flexibility in the types of classes that they need to take to be able to fulfill their dreams and their needs around education. So because they're able to maintain their safe distances, to wear masks in appropriate times, to maintain the hand hygiene and other important things, there's a little bit more leeway in those people maximum number of people that you might contact over the period of a term or a year. So this is a way of managing what could be large numbers of kids that are intermixing and mingling, similar to what we're seeing with social interactions, where you maintain your physical distance, but your contact group is much smaller than it might be if you had 200 or 300 people at a party. So it is consistent with that concept of how we're doing this, and it will look a little bit different in different schools and with different age groups. But it doesn't negate the physical distancing. What it says is we know that we can't always maintain physical distance at all times in schools, so we're going to make sure that the risk periods are small and only with a small number of groups, or a small number of other students, so that we're not potentially exposing many, many others in different areas of the school. So that's the concept behind it. It takes a while to figure that through, and yes, it means that for certain families that'll mean different children will have different contact groups. But we also have to balance the risks that we are trying to minimize in those settings with the very real risks that we know that children are experiencing now from being out of in-classroom settings. And that is something that we haven't maybe not paid enough attention to, whether it's mental health issues, whether it's food security issues, whether it's ability to have a safe home to go home to. There are many different needs over and above the educational needs that children have, where in-classroom settings are incredibly important. So it will be working things out, and each individual family will have to work it out based on their own situation. And that's something that we've known from the very beginning of this, that it affects different people differently. So in terms of aftercare, again, those are things that we're going to have to look at, and every family will have to make some decisions for themselves. And some of that will be who else is in the household bubble, the people that you do have consistent close contact with, and how do you minimize the interactions for people who might be at risk. So that might mean that there aren't certain after-school activities that are with another group of people. So those are things that we will work out, and every individual school and school district is looking at those things now.
Do you have a follow-up, Richard?
I do. Parents are still getting used to this plan, but we're hearing from some already that are just worried about sending their kids back in this situation for various different reasons. Do you foresee any way that there will be any type of virtual learning in the fall for those parents who decide they're not comfortable with the plan? And we're hearing in some cases that it's, vulnerable kids, immunocompromised kids, those that are worried about underlying health conditions that won't go. And advocates are saying that if they miss half a year, a full year of school, they'll never be able to catch up.
Absolutely, and that's why we have this plan in place. There are options. We're not saying that every child has to be in there. That is not what the plan says. The plan says the aim is to support every child in a classroom setting as much as we can. We know that there will be hybrid situations needed in some situations, and we know that there's access to online and other forms of education. But those are questions for the Ministry of Education, the details of those. I will tell you that we're all anxious about this. None of us have been through a pandemic like this before. And we are looking at things carefully and thoughtfully and doing the best that we can to try and balance the risks of children not having in-school learning and all of the social and emotional and other factors that go with the positive effects of being in an in-classroom setting and having those interactions with their teachers and their instructors and the admin staff. And we are also balancing what we know is a virus that has very little effect on children for the most part, but does have effect on older people. And so how do we, we're finding our way in that. And we've been doing it in the healthcare setting. We're doing it in long-term care where we know the risks are great. We've been doing it in making sure that business and essential services keep going in our communities and our grocery stores and, all of those other settings. And we will do it in this setting as well. It's an important setting. It's critical to the future of our children and our communities. And this is why we've spent so much time making sure we're trying to find that balance, and the options are open to people. But I will also say, and this was a point that was made by one of the people yesterday, is that we have always had risks in our school. There is no such thing as no risk. And there's risks of measles, there's risk of influenza, there's risks of norovirus we've seen run through schools, we've seen pertussis, we've seen meningitis. So, these are things that we can deal with. And we've always had immunocompromised teachers, we've had immunocompromised children that we've accommodated in our school system. And we will be doing that again to make sure that we're doing everything we can to protect people, but recognizing that we have many risks in our community, in our homes right now as well. And what we all need to do in BC, and have been doing really well, is keeping our community transmission low, because that protects us all and allows us to make sure that our children are getting what they need.